and the seniors with disabilities. What they're calling their process right now is a significant increase in risk score target. So if you have a patient whose risk score is set at 1 level and then it jumps 5 levels, then that's going to be a red flag for them to audit that member. But there's really no detail other than that as far as Medicaid goes. So we're kind of waiting patiently until we hear something. Strategies that we have in place, I know that I've met with a few groups of people that are in here. We actually have 2 levels of coding in our Medicare Advantage department. We have coding analysts that perform on-site reviews at provider offices. We have provider offices that send us scanned records, and we will review things in-house, and then we also have access to some EMR systems. So the analysts are working through the documentation to, like I said before, making sure the coding that is already reported is accurate, and then also looking for codes that are in documentation but they didn't make the claim. There's been this long-standing thought that, well, and it was true at one day, that you can only report a certain number of diagnosis codes. It used to be 4. There are still limitations in the amount that are sent on initial claims, but you are able to report as many diagnosis codes as the patients have, and then we could capture that information outside of the claim. So anything that's not reported, the analysts are going in and picking up. And then we also have education efforts by a team of coding consultants that will come out to provider offices. We will meet with newly contracted providers to kind of orientate them to risk adjustment like we're doing today. We'll also meet with existing groups to give them an orientation or an advanced orientation. And what I just wrapped up in second quarter was a look at member-specific data with participating providers. So I took 2 patients per provider that were already on their schedule, and I met with them before the patient was to be seen and brought quality measures. They need a colonoscopy, or they're due for a glaucoma screening with an eye doctor. In addition to, hey, these diagnosis codes haven't been reported yet this year, can you please, first tell me if they really have those conditions, and then second, can you please note them in your documentation and code them for the year. So next up, aside from meeting with provider groups, what we also have is a media campaign. Right now we have a blog site, codingcounts.com, with a few blog stories on there, some Q&A, and then some helpful resources. We just started up a new email account, codingcounts@healthalliance.org. So if you have a coding question that's related to risk adjustment, that's related to ICD-9s, we're willing to take those. If you send us anything that's like CPT related, HCPC related, or hey, this claim wasn't paid, we'll definitely filter it to the right person. And it could be somebody at your office that needs to look at it and not necessarily Health Alliance, but we're definitely willing to be that middle person for you. We also have email blasts that go out. We have email blasts about HCC categories, and we also are going to be beefing up the ICD-10 email blasts. And then we have material